Sorry.
मत कर मेरा
नहीं,
कोयम्बतूर
that
का
was
We
in
are
फ्लाइट
English.
live. We are live.
हाय
Good evening, everyone. So it's a pleasure again to welcome all of you another Gyan Pravah series, which is the episode 142 today. And today we are indeed privileged to have with us Dr. Amit Patki sir. We are also, of course, have with us Dr. Sunita Tandulwadkar ma'am, who's our president, who has given us this vision, this mission of this excellent Gyan Prava series, which we have conducted every day, 8 p.m. onwards throughout the month, and we're going to do it throughout the year as well. So thank you, ma'am, for giving us this opportunity. It's a great day for me today to interview Amit Patki sir, and also, of course, to have Sunita Tandulwadkar ma'am with us today, who is the president of Foxy currently and will be the president and is currently the president elect of ISAR. Will be taking over as ISAR president from Amit Patki sir next year in Ahmedabad. So today we are indeed, again, I would say we are indeed happy to have Sunita ma'am, who has joined us personally for this program. She has joined us in most of the programs every evening, 8 p.m. onwards. And I would like to welcome ma'am first of all, and I would like to invite her, being the president of Foxy, being instrumental in so many programs that ma'am has done over this last
थैंक यू
6 months or so.
प्रियांकर इट इज योर डे
Sure,
विथ अमित
sure.
so
So I would like to welcome ma'am to just say a few words of welcome, and I'm sure she would definitely want to welcome my very good friend Dr. Amit Patkisar to this program.
I know. Thank you, Priyankur. All my committee chairpersons, you are doing an amazing job. And today we have the faculty, Dr. Amit Patki. So it's my indeed great pleasure, honor. Amit, come. Welcome on a Foxy platform,
Thank you.
especially Foxy 2025 Pravaha platform. This platform is very important. I just thought that it is for the chairpersons I'm creating. I was tired of those webinars. No one used to join. So I thought these are our future leaders of Foxy. Few maybe the Foxy president. They should know the discipline life. They should know how to interact with the faculty, how to be creative. But believe me, Amit, more than them, I'm getting benefited. Every night, 8 p.m., 99% unless I'm in the air, I join that podcast. And believe me, I have evolved as a person because we not necessarily every time we have an academic and gynec background. We have non-academic, spiritual, philosophical, political. We had Nitin Gadkari with us. We had many BJP leaders on this platform, but more than that, many world leaders we had. And when you hear talking to them about anything and everything, you realize there is so much more in this beautiful life one can explore. And we are so busy with our OBGYN. So I think this podcast series, more than my chairperson, I got evolved. And for all the viewers, Dr. Amit Patki, probably Priyankur will introduce him in the best possible way. But I would like to say a few words about Amit. Amit is my great friend for decades, and we just click with our wavelength. We never agree to disagree. We always agree to agree with each other. That is our quality. And thick friends. And the friendship come with the tremendous respect for the person. The work in academic in ART, the field, the organizational skills. He knows everything in about the organization. He knows how to tackle the international faculty, and that's what I love about it. He is a true Indian, a true academician, and he has taken ISAR to the absolute great level. I think, Amit, you innovated many ideas, and
Thank you.
the all your South conference, South, all the states you are connecting. I just loved it. And I told my team, I'm going to continue this. See, we don't want to change anything. Something you change, then you become a great leader. No, carrying forward the great work done by the past president also is the great leadership. And I just love that idea, and I'm going to continue that. I told my secretary about it. Also, Amit, you are taking over as a Maharashtra chapter chairperson, Maharashtra chapter of ISAR. I know the Maharashtra chapter will have a great leader for 2 years, and it will get, it has been one of the most popular chapter of all our state chapters, but with your presidency it will be another level, and I'm sure Isar will get an honor to felicitate again the Maharashtra chapter under your presidency. Thank you, Amit, coming for Foxy platform.
Thank you.
It's
Thank you.
our honor. It's such a unfortunate that you are a ISAR president on the same year when I'm a Foxy president, and every weekend you have a program which never used to happen before, and unfortunately you never joined for my any conferences, any program.
I
I've
am.
been everywhere, and on 14 15 November you are coming to Pune. I'm aware of it. I'm aware of it. Thank you once again. And Priyankur, you know what? Your पूरी का श्रीनाथ जी की दो आंखें तुझे bless कर रही है पीछे से. I know those. I can recognize any god or any murti with the eyes or with anything. So back to you, Priyankur, doing a great work. You are an amazing orator, and I'm sure any organization you will enter in, you will always help that organization in whatever the best possible way. Back to you to get introduced to Amit. And Amit, our protocol is once he introduces you, probably I disappear, and only two faculty, two personalities having great dialogue with each other will be here. And I'm sure your podcast will be worth listening from the viewers link.
Thank you so much. And before you disappear, let me congratulate you on a fantastic Foxy year.
Yeah,
I think all Foxy presidents have had their own charm, but I've seen that you have got such innovative programs, and it is not only educational. I think you have added your spiritual best to the program, and I promised you I will join you on one of those, but I may just come
Ayodhya. But you
in
finished
Ayodhya,
Ayodhya. We will work out.
Haridwar, Haridwar.
Haridwar, yes,
Yes.
that's
So
fantastic.
I would love to be there with you, and my best wishes and all my support to you. And I think you will be remembered for your Foxy year. I know you're putting in so much of effort, and I think this is one of the important years that the government has also been so kind and so cooperative with you. So we are looking up to you and looking forward to have greater license with various other government agencies and
Yeah,
actually bring a fruitful change in fertility practice in India.
I agree. I
Thank you.
thank you, Amit. Thank you. Priyankur, you are muted.
Sorry, ma'am. Yes, ma'am. Sorry, ma'am. Thank you so much, Amit sir. Thank you so much, Sunita ma'am, for joining us. Sunita ma'am, thank you for giving us all the opportunities. Thank you for giving us all the, like, this year, every year, if we want to do a program, we'll have to look for a sponsor. But this year, you don't have to look for a sponsor because it's all there. It's all given on a platter, and you need to pick and choose what you need to do and where you need to go. So thank you so much, ma'am. It's so much, like, so much of learning from you, so much of opportunities that we get from you. Sometimes, I mean, due to some reasons, we are not able to take the full opportunities. I'm really sorry for that on a personal front, I would like to say. But then thank
We
you so
miss
much,
you,
ma'am, for
Priyankur. We miss
ma'am.
you.
Thank you so much, ma'am, and
And
thank
we
you for
miss
all
only
the
those people whom we love.
thank you so much, ma'am. Thank you for all the opportunities that you give us, ma'am. And it's definitely an honor to work under you, ma'am. It means a lot to all of us. Thank you so much,
Thank
ma'am, once again. Thank you. Now, I'd like to introduce Amit Patki, sir. Of course, all of you know him. He is not only a faculty of national but of international repute. He is the medical director, Fertility Associates Mumbai. He is currently the president of ISAR. Has been associated with many organizations at leadership roles. Has been the country representative of Aspire, governing council member of ICOG for a very long period of time, vice chair of the Mumbai ISAR, that is Mumbai ISAR, Maharashtra chapter of ISAR, chair of West Zone of RCOG for 5 years, and has been the president of the prestigious Mumbai Obstetrics and Gynecological Society as well. He has published many chapters. We have attended many conferences of his with all innovative feel in it, and I'm sure it's going to be one another beautiful 8 months that we're going to have, and of course after that maybe another lovely couple of years under Sunita ma'am as well. So thank you so much to both the
Thank you.
great friends that I have today. today, and it's an honor to have both on the same platform. This is a picture that I'll cherish for my lifetime. Thank you so much for both of you joining us today. Thank you, ma'am.
Thank you.
Thank you so much,
I
Priyanka.
will join the viewers link. Thank you.
Thank you, ma'am.
Thank
Thank
you.
you so much. Sir, yes, sir. Thank you so much, sir, for being here today. I mean, it's indeed a pleasure to have you with us on the topic that we are going to discuss today. That is fertility really rising, and what can we do? What can we do about it? Because I think we cannot have a better person than you to discuss this, because we know that the trend is going up. We know that there are a lot of fertility issues that are coming up. There are things that we need to really decipher whether it's really happening or it's just a myth that goes around. We talk about it to our patients, but is it really that is what it is? So the first and foremost question, sir, the numbers, yes, numbers say probably it's rising, but in your clinical experience, in your perspective, what do you say as the president of the biggest reproductive medicine organization of the country? Is fertility really increasing?
So, first of all, let me thank you for having me on this wonderful Foxy podcast. And I have listened to wonderful speakers, world and national leaders, besides from our specialty of obstetrics and gynecology. So I'm really feeling honored and humbled that I am on this podcast, and I'll cherish it for many years to come. So the landscape of fertility in India has changed in the last 30 years. I remember when I decided to complete my fellowship in UK and come down to Mumbai as a fertility specialist, my consultant was aghast. He was shocked that I wanted to come to a country which was supposed to be one of the most second populous country in the world then. And he in fact told me that you will be starved. You will not have anybody because they all have so many children coming out of their ears. But understand that the incidence of fertility world over is same and is on the rise. And in that time it was 15%. Maybe now I think it is much higher, closer to 20%. So previously, 30 years back, patients would come for medical reasons of infertility. And most common then was tubal factors. Even male infertility was not recognized as much, and there wasn't much awareness. And we all thought that if somebody couldn't beget children, it was the problem of the wife or the female factor. We did have PID, and in our country, tuberculosis was and is still rampant, and most cases would be because of tuberculosis. We practically didn't see much of endometriosis, or maybe we were not aware of endometriosis, because I often say what the mind does not know, the eye cannot see. So maybe we were not aware of endometriosis. But a complete change has happened. The average age of infertility patients then was 25, 27, maximum 30. Now patients start coming to us after the age of 35, and that is why we see a large increase in the trend. It is because now there are more reasons for infertility, not only medical, but socio-cultural reasons are also there. There are lots of couples who are not staying together because of professional commitments. We have large number of people who work in call centers, so they work, one works in the day, one works in the night. We also know that the incidence of sex has reduced in the last 2 decades for sure. And this is because of various different forms of, of entertainment, as I can say. So we know that the landscape has changed and fertility is definitely on the rise, starting from the age that women get married. That has gone up, after which they do not want to start a family for a couple of years because of maybe career, profession. Nowadays, expectations of couples have gone up, so they move from their own comfort zone. They come to larger cities. They live in very small houses. It is expensive for schooling, so they think of all these things even before having the child, and that is why they push it off. And we see large number of couples getting old, so we now see a large number of them having poor ovarian reserve. And we also see this in the younger couples. We see that in a large number of young patients where we find that the ovarian reserve is low. And I feel that is because of environmental pollutants, because of lifestyle disorders. We also see a large amount of smoking and alcohol, not only in the partner, but I personally feel in urban big metros, there is a substantial increase in smoking amongst young girls and young ladies. So these are new factors that have added to the incidence of infertility. And that is why I think we see a increasing or a rising trend in infertility.
Great, sir. Thank you so much, sir, for beautifully outlining most of the social factors that we see around us. The factors to a certain extent, the female factors also you did talk about. We all know, sir, probably when we were students, we used to talk about, infertility means female factor. There's nothing called a
Correct.
male factor that used to exist. But today we know that male and female factor, if you put in a pie chart, it's almost 50-50%. Of course, yes, male, female, and the mixed factors, if you put together, it could be 50-50%. So, sir, we all know that there's a lot of stress that's going around. There's a lot of work related travel pressure, etc., that's there for the male partner as well in today's day. So would you like to attribute a little bit, or enlighten a little bit about the male factor infertility? What do you think could be the major factors in it?
Absolutely. I think it's very good that you have brought this up about male factor infertility. And although we say that the husband semen test should be one of the first tests that we should do for a couple, even in this day and age, I find sometimes women are extensively investigated. Sometimes they have been also put on planned relations, even without a simple semen analysis done. So I think it's extremely important to look at that man who's sitting next to the woman. And we talk about obesity in women, but I think it is common about obesity in men. I'll just give you a small example. We did sperm DNA fragmentation for 100 couples who had IVF failure elsewhere, and they came to us for a second opinion. And where male factor infertility was not documented as one of the reasons for their IVF. When we did their sperm DNA fragmentation, we found that more than 50% of them had raised DNA fragmentations, and this was attributed to obesity, it was attributed to undiagnosed diabetes, hypertension, to metabolic disorders, to even hypothyroidism. We had men who had varicocele but were never examined because the first semen report was presumed to be normal. And after that, the male is not looked at. So if you see a male who's 120 kgs sitting next to his wife, I think we should be giving the same lifestyle advice that we give his wife for polycystic ovaries, asking her to walk, diet, exercise, lose weight. I think the same thing should be told to the man to lose weight, because once we gave this lifestyle advice, we found that the sperm DNA fragmentation came down, and 15% of these patients conceived only on lifestyle and antioxidants. And the next time they went ahead for an IVF, a substantial number of them conceived. So I think it is extremely important we look at that man, we investigate the man. I don't say do sperm DNA fragmentation for everybody, but in risk factors, but particularly in men over the age of 45, in obese men where the BMI is more than 30, 33, where you have got men with history of diabetes, hypertension. I think it's important to treat that, because once you treat the metabolic disorders, you ask them to correct their lifestyles. You see men with recreational drugs. I see a lot of young men going to gym and taking creat powders and creatinine supplements, not knowing that that creatinine is going to severely affect the sperm parameters. So I now proactively ask couples if they are on any recreational drugs like weed, or if they are taking steam sauna, because they feel it is good, healthy to do it, but sometimes they overdo it. There are men who take protein shakes, not realizing that there is creatinine in those shakes. So it is very, very important that you take a detailed history of these men, because if you find that they are in the risk factor, it is important to do this DNA fragmentation, not because you need it, but you need to convince that 120 kg man or that person taking protein shakes, create powders, that he needs to get his lifestyle in order if they want to proceed ahead and have a successful pregnancy.
Outcome. Great, sir. Thank you for your insights, sir. So there are a lot of studies from developing nations and developed nations, including India, where they show an increase in the rise of couples at the other fertility clinics, and this is especially among the urban population. We also know that most of the women or most of the couples who come to these clinics are on an average aged between 32 to 35, more between 35. So, sir, could you give some insight or some point which you would like to share over here for others, probably to share it with their patients, that what is your take on this delayed childbearing? And what is your take when should be the ideal age when they should, sort of start trying so the natural conception should not be a hindrance?
Good question, because we all face this problem of when do they start investigating or when should they approach a doctor. Although our books and fertility definition says that you need to wait for a year of unprotected sex, but often if the couple is over the age of 38, I think we need to proactively tell them to start investigations at least. We now have couples who come for for infertility check even before they want to try for a baby to know what is their fertility potential. So I think in women doing an EMH always helps, because you can actually categorize and tell them which ones are at low risk or which ones have a poor reserve and need to proactively start their treatment, because the FSH will rise only once the AMH is very critically low. The periods become irregular once the AMH is less than 1. By then, you have lost the battle. So, I think it is very important that the couple should have their first child before the age of 35. And I feel as a parent of two children, it is extremely, extremely important that the child has a sibling, because I think it is important that they grow in an environment where they learn to accommodate, they learn to share, they learn competition, they learn a lot of things at home if they have siblings. I've also seen that if there is a one parent family, there is lot of pressure on that child from both the parents, and quite often that can be very daunting to the child. We no longer live in a joint family scenario. It's always where we have couples who are staying on their own. So often the child doesn't have even cousins where they can actually share. And it is like extremely important that children learn all these in their younger formative years. It is important also to talk about lifestyle to these couples. I know sometimes some couples come very late, and I tell them that in major metros A and B, they will be looked after by obstetricians very well. But I shudder to think that to be called a good parent, it is extremely important that the couple has to be mentally, physically, and financially fit for the next 20 years of the child's growth. Only then they can be called as good parents. It is not important just the 9 months that they are in utero, but it is important that the couples plan for the next 20 days. We all know how expensive education is and how very expensive higher education is, and we all aspire and strive to give the best to the child. So I think it is extremely important that you don't the child should be an asset and not a liability to couples in their retirement age. So it is important that they have their first child before the age of 35, and if they plan a second one, it should definitely happen before the age of 40.
Thank you so much, sir, for that, beautiful your take on the delayed childbearing and when they should start trying, etc. Thank you for that. So medical factors, yes, there are a few medical factors that we talk about normally. We do talk about PCO, thyroid disorders, endometriosis, which are factors that is a deterrent towards childbirth. Sir, of late we have been talking a lot about sexually transmitted diseases and PID being a deterrent. Can I get a couple of comments of yours on STDs and PIDs, which are leading to an increase in the burden of infertility in the current years?
Correct. So I think it is important that sex education, which Foxy is taking a large role in creating awareness amongst college students and graduates, should be prom- pro- promoted, because I think it is important that the sexual promiscuity has increased, and they have to take care for themselves. I don't want to be a moral police. I don't think as a doctor I should tell them what is morally right or wrong, but as a doctor I should tell them how they have to protect themselves from sexual promiscuity. And also now we have got vaccines which are available to prevent cervical cancer. But simple use of condoms is very, very important, because sexually transmitted infections like chlamydia, gonorrhea will affect their fertility, because it does affect the tubal factor, and quite often they repent for the rest of their lives. I also tell them about getting unwanted pregnancies, and the best way, effective way, is to use something that the patient can control. Often in a relationship, we rely on the man to use the condom, but I often tell my young uh, uh, girls that you should have something to protect yourself which you can use, and that's where the birth control pill is very effective. And they should use both the barrier contraceptives to prevent sexually transmitted infections, and they should use the birth control pill, because that is the biggest power the woman has in her hand to ensure that she doesn't land up in problems of unwanted pregnancies. So I think sexually transmitted infections do play a role, but the education has to start very early in high school or maybe in college, where they are taught how they can protect themselves and lead a good and healthy and infection free life.
Perfect, sir. Thank you so much, sir. So we have, by our discussion as of now, I think we have made it quite clear that there is an increase in infertility rate over the last few years. It may be because of various factors, but now if we can look at a few things, what we can do about it, I think that is what is more important. So, sir, first of all, I would like to ask you about what is your take on sex education and counseling? Will that help in probably decreasing the incidences of infertility in the life of the girls of now and the women of tomorrow?
Absolutely. I think the right knowledge is very important, because in our school days we didn't have any education, and I think most of our generation or the earlier generation resorted to getting in information which was unsolicited, which means that you would get information from various porno sites or semi porno sites, but the information is not correct. I think sex education in school is in colleges is extremely important, more so because now the children will try and access it elsewhere if they don't get the correct information. I'm proud to say that Foxy and the local organizing bodies have worked very hard for the last 10, 15 years by having these various school programs, not only for girls, but even for boys. There are lots of myths about sex, about protection, about masturbation, and various different things. And I think these myths are slowly getting resolved because of these wonderful sex education programs. So it is part of growing up, but I think it is important that they have access to the right information. And I think the young generation of today is very, very intelligent. they have a lot of access of information, but it is our duty as doctors to assist teachers in spreading the right knowledge about sex education.
Perfect, sir. Thank you so much, sir. We do talk a lot about preconceptional health. We talk about obesity. We talk about probably recreational activities, like you said, alcohol intake, smoking, today's drugs, weed, etc. That also can be talked about. So, sir, what is your take on the preconceptional health optimization, or rather, running a preconceptional clinic, which and how could it help in decreasing the incidence of infertility?
I think it's a very good idea. And nowadays, couples do come to us, as I said, to take pre conception advice or investigations, because they then know that if there is a problem, then they would be happy to solve it rather than wait for many years. These clinics are there in the private, and I think some of the government or JVs are also starting these clinics where you do basic test for couples, where you do a basic semen examination. I think even ensuring that there is no beta thalassemia in both of them is very important, to do their infection screening so that they are aware if either of them has got hepatitis or HIV, so that they can be treated. We can bring the viral loads down, they can be properly advised. So I think screening for infections, doing the basic hormonal test in both the partners, doing a semen test, making a small package is very important, so that they know that they are all fine, and if they are not fine, that then that can be addressed, so that when they want to start a family, they do not waste more further time. I think in infertility now, fertility preservation and rejuvenation is something which is important. I don't mean about doing some stem cell work. I think in their own way, people can preserve their fertility, and that is by making sure that they don't get infections, by making sure that there is no obesity, that they look after themselves, proper diet, proper exercise. There are lots of things that women can do before they conceive, about environmental pollutants, and about using highly processed foods, decrease use of plasticware. And these are, very, very basic things. But I think it is important that we spread awareness that this not only will affect their health, but will also reduce their fertility potential.
Sure, sir. Thank you so much, sir, for your insights on the preconceptional health optimization. So next, I would like to bring to the notice of the audience on this important topic of environmental awareness. I think all of us of late have been talking about EDCs, environment disrupting chemicals, especially bisphenol A. We've been talking about artificial sanitary pads being one of the factors causing CA vulva, causing PCO, etc. We have had a recent study which Dr. Sonia Malik was talking about, and this was published elsewhere as well, where they talked about gut dysbiosis, and they linked it to PCO. We have heard you talk about PCO as well in multiple occasions. So, sir, what is your take on this environmental awareness factors, and what are the things that can be done to decrease the chances of increasing the incidence of infertility? We also would like to take your take on the exposure to plastic, pesticides, processed foods, which has become so very common in today's day, keeping food in plastic boxes and heating them on a microwave, things that are not right for the ovaries. We know it, but it has become so common that even if you tell them, patients do not want to listen to you. So what is your take, and how do you address that situation, sir, and what should we do about it?
I think it is important we talk about endocrine disruptors, as we would call these environmental pollutants. Now, the pollution has increased all over the world, and particularly in India and in big cities, because of various reasons. I know that we are living in a highly polluted world, and because of which then we have to use highly processed foods are happening. We get these hybrid things, we get foods which are exposed to pesticides, to chemicals. And I think in every daily life, we are using a lot of chemicals in our life. So going back to nature is something which is very important. Growing organic food, which I think the government is trying to promote, trying to eat fresh food, food which is not exposed to pesticides, trying to be as close to the nature is something which is important. And in that respect, I think walk, exercise is very important. There are people who work from home, and for days together they are not exposed to direct sunlight, and that is why I think is one of the reasons we see such low vitamin D3 levels, which is one of the reasons why women come to us for infertility with poor ovarian reserve. I think it is important that they get exposed to the sunlight. Simple thing, 20 minutes of sunlight, which we took for granted in our country, is not being availed in our country. So I think it is important that you find out what what occupation they're doing. You have people who work night shifts throughout their life. You have people who work call centers and irregular hours and sleep during the day. You have people who work from home and never bother going out of their house because thanks to Swiggy, Blinkit, and Zepto, they get everything at their doorstep. But I think they don't realize in the process. I see a lot of women looking shallow, looking pale because they're not exposed to the sun. And when you do their vitamin D3s, they are abysmally low, they are in single digits. So it is important that they have to be understood that if the mother is not going to be fit and healthy, whatever I do, nature will make sure that she doesn't get pregnant. So the first thing is that the woman has to be healthy, for which we see a lot of women, we see a lot of obesity nowadays. And that is surely because of lifestyle. And this obesity, unfortunately, starts from a very young age. There are disturbing papers to suggest that 33% of adolescent girls in India not only have PCO but are on the obese side. And this is across rural and urban. Gone are the days when home cooked food was preferred. Nowadays, people will prefer to ordering foods, and this I see across the country. So I think it is very important that we tell them that they have to go back to nature, be close to nature, and small things, avoiding plastics. As you said, it is so convenient to store food in plastics, to heat it in the microwave in plastics, use plastic water bottles. We now know that the cement tests have shown microplastics in the cement sample. So the plastic has invaded our body, and we see microplastics even in cement ejaculates. So that is the level that we expose ourselves to all these endocrine disruptors. We talk about pesticides, we talk about strong detergents, we talk about strong soaps. So it starts from everyday life that we have. We talk about plastic bags, we talk about credit cards which we touch and which we find that there is a lot of plastic. So people now have mobile phones are the biggest culprit, I think, nowadays, where they are exposed to all these radiations, and we really do not know what effect it will not only have on us but on our progeny a few decades later.
Absolutely. So I keep saying this. I think mobile phones, cigarette smoking, and alcohol are probably the three things. If I tell a patient not to use it today, they will probably stop coming to me rather than stop using any of
They will
these.
feel lost. Correct, correct.
Yes. So I think very aptly said, sir. Thank you so much for it, sir. So next, a very important topic which I really wanted your insight on is on mental health and the support that is to be provided. Because we know in today's day, mental health probably takes up a major toll on the fertility factor. We can talk about probably nowadays fertility consultants are called as fertility coaches as well. they talk about the mental health, and we have seen a major burden in cases, especially in cases of probably erectile dysfunctions. The mental health seriously gets affected to the tune where sometimes the husband is not coming to the hospital. Sometimes, if it's a azoospermia, the husband is scared to come to the hospital. But on the contrary, we have seen in this rural part, like I come from Siliguri, sir. I have had a couple who had come to me. I think the husband, it was his fourth marriage, and he told me that he had divorced his three wives because they could not bear child. And this time when I investigated, the wife was perfectly fine. The husband was azoospermic. So it was like, three divorces for nothing because
Correct.
ultimately it was the male factor. So, sir, how do you? But then we have seen the other side of the coin as well. The guy getting totally into the cocoon because he finds out that something is not right with him. The society is not able to accept it. So, what will be your take from your practice from a tertiary level hospital about mental health and how it takes a toll on the families?
I think mental health is very important world over, especially in our country where infertility is not a couple problem but a family problem. We know that infertility is discussed on the dining tables and lots of people give their opinion. So it starts from there. It becomes something, it is considered inauspicious. Women who cannot have children are not invited for naming ceremonies and birthday parties of young children because they are considered as bad omen. So there
Woman.
is lots of social ostracizations of couples and women who are infertile. So we come from a country where women are supposed to beget not one, two, but as many children as the family desires. So not having children becomes a very big issue. That is as far as women are concerned. We also have obesity, body shaming, and various things that affect. So women get very, very affected even with negative results in IUI and IVF. And it is very important that they have somebody to talk to, some companion. So I think most fertility clinics would be having a counselor, and it doesn't have to be a medical personnel because they need to share a lot of thoughts. We see a lot of domestic violence because of infertility. We see a lot of marriages breaking up, and sometimes the women feel that if a marriage is breaking up, having a child will save that marriage, which unfortunately is not true. So we see a lot of mental issues. Now coming on to men, men always equate fertility with male vigor. So when you have somebody who has got azoospermia or male factor, it is considered that he doesn't have the manliness in him or the maleness in him, which is not true because we know that most of these men who have got male infertility do not have do not have sexual functions or sexual dysfunctions. Having said that, I think fertility units contribute a large amount to male erectile dysfunctions. The availability of ovulation induction kits in the market and telling them timed intercourse puts a lot of pressure. In my practice, I find 6 out of 10 men who are asked to perform on a particular day fail, not because they have erectile dysfunction, but because it is psychosexual. It is they cannot perform on demand. That is a problem with some men. And that then becomes like a vicious cycle. Each time they're asked to keep sex, they have got erectile dysfunctions. And after a few failed attempts, they would find any reason not to have sex. So, this is a big problem. And I think sometimes, as fertility doctors or specialists, we add on to this problem. Quite often, we get couples who come for infertility, but on close history itself, we suspect that there is non-consummation of the marriage, and when you examine the woman, you find that the marriage is actually not consummated, but they have hidden this fact for not one, two, but sometimes I get couples of 10 years of marriage with non consummation because of vaginismus, which can be so easily treated nowadays with simple vaginal dilators. And I've had couples who have been so grateful that they say that 10 years of our hiding this and we have managed to solve this problem in a couple of weeks. So I think it is important at the history time we talk to them, we give them enough time to express themselves. If at any stage in the treatment or investigations they feel that they're getting stressed, that the thought of taking treatment itself sometimes stresses, I think it is important for them to see a counselor. So, mental health and infertility go hand in hand. We know there are enough studies to show that, and particularly in PCO patients, because of obesity and body image, this problem is multifold.
Thank you, sir. So we almost are like 15 minutes away from the end of this podcast, and we'll have two very important topics. You heading the biggest fertility organization of the country. So one question I definitely need to ask you is about advocacy and policy. So you feel any advocacy changes anything with policymaker decisions which could help the fertility treatment in the country? We all still do understand that the major population or major bulk of these clients who are not able to conceive or having infertility also has financial constraints. So, do you feel any changes in advocacy or policy could help them in the long run?
Thank you so much for asking this because ISAR has been working on two fronts. One is liaising with the government, and secondly is trying to liaise with insurance companies and trying to get fertility on the insurance, because I think that is very, very important. WHO has also defined fertility as a disease. It is time that we stand up and we tell the insurance companies that they have to put infertility in the package, because it really will take a large burden. We all know fertility treatment is expensive because of the infrastructure, because of the drugs, because of the equipment that is needed. But having said that, 75% of infertile couples don't need the advanced treatment. Most of them can be sorted at basic level. But having said that, we still need some amount of infrastructure. The second thing is liaising with government, and there was a very beautiful WHO paper which was in association with ISAR, which showed that the replacement rate in India, barring 5 states of 29 states, was less than 2. The normal replacement rate should be 2, and in India it is 1.8 and 1.9, barring 5 states. So I think it is important to change the concept in the government itself. Government pays a lot of importance to family planning. They have to soon understand that family planning doesn't mean only contraceptives or medical terminations or tubal and vasectomies. It also means family welfare, and that is what ISAR has put forward to the government to change the because the change has to start at the basic level. You can't call it a family planning unit; it has to be called as a family welfare unit, because then the thinking, that soch will change only when you change the name. And that is extremely important, that government takes into fold not only all these contraceptive methods and medical terminations and sterilization, but offers help to those couples who can't conceive. And that all has to come in under one umbrella, I feel. And we have been having large number of meetings. I think our message has gone to the government, because I can see a change in the central government in how they talk to us and how they look at to us. Previously, infertility was considered as a disease of the rich, and only rich people could afford it. But now we know that infertility is common not only in the rich, in the poor, not only in the urban, but in rural and semi-rural. And it is important that the government also changes their outlook and attitude towards this. So simple change in name, calling family planning units as family welfare unit, will help people in the government sector and public at large to look at infertility as a disease which it rightly deserves, and then maybe have the insurance companies put up infertility as part of their package.
Perfect. So I think having leaders like you at the forefront and the past ISA presidents, the future presidents, I think all of you putting it all together, sending a message to the government is very important. And this thing with the insurance companies, I'm sure is going to help many couples get pregnant in the near future and future ahead as well, sir. Now the final question, sir. We cannot end our topic in today's day without talking about AI. So I would just like your insight about AI. Where do you think AI will take infertility in probably 5 to 10 years from now? Do you also feel that we, the fertility specialists, will be replaced and it will be only AI that will be doing everything in the future? So, what is your take on it? And we would like to end after this final, discussion with you.
Thank you so much. I don't think we have to be scared of anything. As I said, it is very important that technology and the human mind works in sync with each other, and this is a perfect example where artificial intelligence will definitely make a world of change in our practice. I have seen it coming, and I can see the large number of places where AI will enhance our practice. I don't think the AI will replace even my embryologist, and it will never ever replace the fertility specialist, because human mind has got much more power than any sophisticated equipment. But we have to make AI our slave. We have to use AI how we want, and that is where I think our genius or our intelligence is. Starting in the lab, the AI is now helping us to choose the right sperm. It is helping us to grade not only eggs and embryos, but perhaps tell us among those five good looking blastocysts, which one probably will give me the best success rate. So we have to use AI to help us to reduce the time to pregnancy. AI in clinical practice will help me to decide the dose for the patient, which protocol to use for the patient, when is the right time to give the trigger, and which eggs will perhaps give us a better success rate. So I think we don't have to feel scared of AI. I think AI will make our treatment not only effective, but I think also cost effective. If I know what dose to give, I'm neither going to give understimulation and overstimulation to my patient. So it's going to be cost effective. It is going to tell me how many days of stimulation so that I get the right number of mature eggs. It will tell me when to transfer which blastocyst, to I reduce the number of cycles the patient has to go. And that's why I think it's going to be very, very good slave. I'm putting the right word. If we have to make AI our slave and make it work for us, I don't think it will ever replace anybody in the infertility practice. For sure, I think it will only help us to enhance our practice, choose the right treatment for the right patient, choose the right protocol, the right dose, and the right gonadotrophin, and also maybe choose the right blastocyst or the embryo, so that we can give the best success rate in the shortest period of time.
Thank you so much again, Amit Patkisa. That was a wonderful discussion that we had. Learned a lot from you. I have worked on with as a managing committee member of ISAR under your leadership. We have gone through so many programs. We have heard so much from you, and this is yet another program where you always inspire us with your comments and with your talk. So this was an excellent session. I thoroughly enjoyed this dialogue, and I'm sure all that who have joined this program as well must have enjoyed the same as well with a very good
Thank you very
take-home
much.
points
And
from
I
you.
just need to give some message to the young fertility specialists. I think they are in the best of zone of fertility. I remember my days 30 years back when we started, we had to make our own media. We didn't have a choice of gonadotrophins. We didn't have cold chain management. I think now they are spoiled for choice. I think they are in the best world, and I think they should use AI to their advantage. And I think one thing they already are, but I think they have to be passionate about their job and be truthful not only to themselves but also to the patient, and have a good ethical moral practice. I think this is what we need. This is the need of the hour. I think we have infertility is on the rise. We are going to see an explosion in infertility centers, which is necessary because no longer the patient needs to travel from small towns and villages to big cities. They have it at their doorstep. But I think it is important to put the patient first and to look at that and be very truthful to the patient, tell them what their chances are, what their success rates are, because they come with so much of hope. I think some amount of tender, loving care also makes them feel happy. We have couples who are happy with us, even if they have not conceived, because they feel that we have looked at them as a human being and not as something that we need to just treat and let them go.
Absolutely. So I think we have heard this word from you over and over again about being truthful. And that I think is very, very mainstay. I mean, I also quote Dr. MC Patel sir here, and he always keeps telling us that do not promise Aishwarya Rai because it ultimately might turn out to be a chimpanzee. So promise what exactly it is. Do not overpromise, but over deliver. I think that is always what the patient also prefers from us and always, respects us for it. So thank you so much once again, sir. It was a wonderful learning session from you, and we will definitely look forward to further sessions with you as well in the future.
Thank you so much, Priyankur, and you have been such a wonderful asset in ISAR. And I wish you the very best. And I look forward to having you in more of our programs. And thank you to Foxy. Thank you to Dr. Sunita for having me on this wonderful podcast series. And I look forward to many more collaborative uh, projects between ISAR and Foxy. Thank you once again.
Thank you so much once again, sir. It was wonderful to have you here. Thank you once again.
Thank you.
Take care, sir.
Thank you.
Thank you. Thank you.